A new report shows cancer survival rates are on the rise. The American Cancer Society's latest annual report revealing 7 in 10 people in the U.S. are now reaching the 5-year milestone after a cancer diagnosis. ABC's Melissa Adan explains.
Nearly 6,000 people will be diagnosed with cancer daily, according to the American Cancer Society. But despite the scary news that often accompanies the disease, the Cancer Society's latest annual report revealing the U.S. 5-year relative survival rate for all cancers combined is up 70% for people diagnosed between 2015 and 2021.
About 35% of folks with metastatic disease are really alive at 5 years. That's a huge improvement.
Dr. William Dayhut, the chief scientific officer of the American Cancer Society, explaining on Good Morning America today why cancer survivability is up.
If we went back to the 1970s, less than half of the people would be cancer-free or surviving, at 5 years. So it's really been driven by a couple things. Number one, tobacco. Tobacco use and really drives so many cancers. So the fact that 44% of people are smoking in the 60s, like only 11% now, that's dramatic. Second, for those cancers that we can screen, early detection has made a difference. And finally, therapy.
The Cancer Society says the death rate has now declined by 34% since its peak in 1991.
People reach out because they know that I've gone through it a couple times.
Right.
And I tell them, the progress that's been made since I was diagnosed, the progress that has been made is tremendous.
Yeah, we're in our last miles. In a marathon, the last miles are really hard. We're not there yet. But if we all work together, we can slug up those last 6 miles and get to the end there.
So there is hope. And
there's
I think
definitely
that's what
hope.
The American Cancer Society report also notes that certain common cancers are still increasing, including breast, prostate, and colon. And the Cancer Society says science is working hard not only to improve outcomes, but to cure patients. Melissa Adan, ABC News, Los Angeles.
Today, legislators and advocates announced bipartisan legislation to lower high prescription drug costs. The Affordable Medicine Act would establish a prescription drug affordability board. That would be an independent body of health and medical experts that will create limits on how much Virginia consumers will pay for certain medications. It would also extend federally negotiated prices of Medicare drugs to hundreds of thousands of Virginians not on Medicare.
When you have to make choices between food on the table, a roof over your head, and the medication that you need to stay alive, that is an unfair choice for any Virginian, and it's something that I think is really going to bring people together.
A 2025 poll from AARP found that a record high 84% of Virginians support the creation of a prescription drug affordability board.
On Capitol Hill today, Senate Republicans blocked passage of Virginia Senator Mark Warner's Congressional Review Act resolution. It would have overturned a Trump administration rule Warner says makes it harder and more expensive for people to enroll in health care coverage through the Affordable Care Act.
It's estimated it will drive up the cost of health care about $3 billion, and about 2 million Americans could lose health care just from the administrative hassles put in place.
The resolution sought to nullify a Trump administration rule by the Centers for Medicare and Medicaid that reduces covered services, increases premiums and costs, and impose new bureaucratic hurdles for families and states.